Next on Imagenes, Depression and Spiritualism. Saludos, I'm Miguel Perez. It can devastate a family, ruin careers, force people into seclusion, and even lead to suicide. We're talking about depression, an illness that strikes 2 out of every 10 people in our society. Right now, in your home, there could be someone suffering from depression, and you may not even be aware of it. Even that person may not know what's happening. How do you know when you have it? Are there treatments? Is going to a spiritualist the right answer? Today we'll get some advice on the often mysterious subject of depression from Mercedes del Valle Rana, a psychologist from East Orange, New Jersey, and Elena Dejines, a career woman who was affected by depression after a traumatic experience in her life. It's a pleasure having you here, ladies. Doctor, please tell me about what is it that is so hard for people who are suffering from depression to convince other people. Mike Wallace, the case of Mike Wallace comes to mind, a famous reporter for 60 Minutes who did a report on depression. And he said in that report that he had a problem getting his friends, even his doctor, to believe that he was suffering from depression. Does that happen often?
Yes, only because everybody goes through periods of the blues in their lives. There are times when we all feel sad. And so when we're feeling sad and we tell other people that we're feeling sad or that we're depressed, it's very common. It's a commonality. There are different stages and different periods during absorbers. We feel more depressed than other times.
So people don't take it seriously. Let's say, oh yeah, I've had that for 5 minutes and it's not the real thing.
Right, and you'll get over it.
Tell us, please, what it is that made you feel depressed. When did you know that you were going through a depression that was different than the blues?
Well, back in 1993, I was in a very bad car accident. And because of this car accident, I had to resign from my job as a certified shorthand reporter for the state of New York, which I worked 15 years in the judicial system. And because of this accident, and my doctor telling me there's no way in the world that you can work this way, since it was when I was diagnosed as suffering from major depression, because I was no longer able to function as a court reporter because my brain was not functioning properly.
You weren't able to concentrate on your work?
I wasn't able to concentrate. I was constantly crying. I felt alone. I was paranoid. I was in fear. I literally hibernated at home. And I can't say that my family isn't supportive, because they really are. I come from a very good family. The only thing is that with depression, if you don't have it,
you don't understand it.
A person cannot relate to it. Mm-hmm. I consider myself the sadness behind the mask. Okay? It's my shadow. Mm-hmm. I fight with it every day. But one thing that I know it cannot take away from me, or I won't let it, is the love that I have for mankind. And my reason now that I know that I have to fight this, that I have to live, because I'm not crazy. I mean, it's not like you can choose what illness you want.
Of course.
Okay? I didn't expect this to happen. I worked very hard at my job. I was a perfectionist. At least I didn't lose my ability to sing. I still sing. Mm-hmm. And I had to leave all that. And I started, it was something I had to do and work very hard at, because I am Spanish and English wasn't my first language. Okay? So everyone kept telling me, no, it's not going to work, it's not going to happen. But I made it.
Well, we'll talk about that language barrier in a moment.
Okay.
How difficult is it to diagnose somebody as having depression as opposed to the blues? When, doctor, do you know that this person is a more serious case than just a temporary case of the blues?
Well, specifically, I will focus on children because that's the area that I work most with. And children, you know that children are experiencing depression when they tell you that they feel sad, when you see sadness in their faces. Also, when they decide that they want to not live any longer. I have had a child at the age of 5 that wanted to choke himself with the telephone cord. I have had another child, Latino child, who also wanted to run across the street and not live, kill himself. He was also very trying to hurt his brother and his sister. He has an auntie who's very ill, and she's dying, and it seems like he cannot deal with the loss. So children, as well as adults, a lot of times the depression may set in when there's a major life event. So those are signs. Also, you know that because depression is hard to define, or not hard to define, but hard to accept, we have to look at a number of characteristics that go into looking at depression. And those are crying, the inability to stay positive. You don't see a person smiling too much.
Well, we have a whole chart. We have a list of them. And let's look at those, because I think we're going to put those up on the screen. There they are. And let's go through them. Sleep disturbance, appetite disturbance, problems concentrating, lack of energy, loss of interest in unusual activities, helplessness, hopelessness, feeling of sadness, increased absenteeism and lateness, crying spells, impatience, alcohol or drug abuse, thoughts of suicide. How many of those did you experience?
Practically all of them. I've been hospitalized several times because I did want to die on several occasions. Not because I wanted to kill myself, but because I knew the only way to be at peace was to kill the depression. So I was hospitalized several times in the Carrier Foundation, where I went through endless psychotherapy and all sorts of medications, because one medication might help one person may not help the next individual. And it's quite a hidden disease because, like I said, if you're not actually living it, you cannot relate to it.
And when you're going through this, what motivates you? What is it that you use to take you out of the depression? Is there something now that drives you to say, I want to keep on living?
I fight it.
How? What is it that you think about?
I don't. I speak to it.
And what do you say to it?
No, you're not going to do this to me again. No. And I'll focus on something else.
Okay, what do you focus on?
Music. And I sing.
Okay, and that gets you out of the depression?
Yes. Not totally, but at least temporarily, at least until I can calm myself down and the depression can somewhat take a walk, so to speak, for lack of a better way of putting it. But now, just 2 weeks ago, my son gave me the greatest gift of all with the birth of my first granddaughter, Yesenia Mariga Ginés, in Spanish, and I have to live for her.
So that's your new motivation now?
That's my new motivation. Plus, I believe in the power of prayer. I have to leave a lot up to God because I'm only human. It's sad, though, that since so many people don't understand it, they misinterpret you as an individual. And you're constantly saying you're sorry. I find myself constantly saying I'm sorry, and I can't be sorry all the time. I mean, someone's got to say, hey, I may have done something wrong. But it's just not the blues. It's not sadness. It's much deeper than that. It's your brain actually controlling you.
Doctor, how does it affect a family? What do you hear from relatives of some people who are suffering from depression?
I think it's real hard, especially for Latinos, to deal with depression because we are not people who like to talk a lot about anything that may relate to some kind of illness, be it mental illness or especially depression, because we don't know how to deal with it. So a lot of our illnesses that either deal with the psychic or that could be biologically imposed, we have a hard time dealing with. So we usually say that we are, estamos mal de los nervios, or we...
our nerves are acting up.
Our nerves are acting up. And we hear that a lot, especially amongst women. Yo padezco de los nervios. What does that mean?
Yes.
Okay, that could mean many, many things in our culture. So we have to kind of explore it with the person, and we have to bring the family in and provide a structured, nurturing, cultural setting where we can talk about this in a loving, caring, nurturing way.
Okay, but do you bring in relatives of the person who is suffering from depression and explain to these people what depression is all about?
Yes.
I think that probably is very important for them to be able to understand what this person is going through.
Yes.
Because sometimes, your husband or your friend may be sitting with you watching a movie, and something happens in the movie that's funny. I know this from personal experiences. I knew someone who was manic depressive, and I'd be sitting next to this person watching something that was very funny, and I would be laughing. And all of a sudden I turned around and I realized that this person had a straight face and wasn't funny, didn't find it funny at all. And I began to question whether I was being goofy for laughing at something that was funny, and it was affecting me. So does this happen, that the people who live with manic depressives affected that way?
Yes.
So how do you, what do they tell you? What do your relatives tell you about the impact that you have on them?
Actually, my relatives had to get educated on depression. Because at first they kept saying, oh, come on, go take a walk, do something, eso se te quita, everything's gonna be all right. And I kept saying, no, I don't understand this. I don't understand this. And there were times when my husband found me in a fetal position on the floor when he got home from work. And all I kept saying was, I just wanna die, just let me go. It's easier to be dead. He says, no, 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 you do not want to die. I couldn't live without you. He's a wonderful man. I have to give him that much. I have wonderful children, but they also had to get educated in depression.
Even general practitioners, doctors, go through that, where they, if they're not really into depression, they don't understand, and they'll say those things. Oh, you get out of that, don't worry about it.
They say you'll feel better, and they try to do a lot of talking to make you feel better, because there are a lot of different types of depression.
Okay, let's talk about those, please.
Okay, let's look at, there's unipolar depression, which only lasts about 2 or 3 weeks, and you go into a depressed mood, you lose interest, and a lot of the characteristics that you mentioned there. But now if you talk about bipolar depression, one of the things about bipolar is that you have extreme mood swings. Like Patty Duke, when she showed her movie on being bipolar and manic and I have a friend who's bipolar. And what happens with bipolar people is that for the longest time they're doing fine. But their behaviors are somewhat exaggerated. So they take everything a little bit, they do a little bit in excessive amounts. That's how you know that they're manic. However, they also go to extremes where they get extremely depressed. My friend called me recently and says, I'm leaving, I'm going to the rehab, I'm going to check in. I cannot control my acting out behaviors anymore. And I could see the extremes where one time he's very involved with me on a major project, and then the next time I don't see him for 3 or 4 months. He won't answer the phone, he crawls in his bed, he doesn't speak to anybody, he loses his appetite, all the physical symptoms start coming out. So bipolar is very interesting because of the extreme mood swings. A lot of people suffer from dysthymic depression. And dysthymic depression is chronic. That lasts over a period of 2 years. So there are different types. There's also the psychotic depression. And the difficulty with psychotic depression is that people lose touch with reality. And a lot of people probably confuse that with schizophrenia because you lose touch with reality.
But what causes that? Is it a chemical imbalance in the body, or is it a mental state?
Well,
or is it both in different cases?
right. Well, depression has been linked to certain what are they called, neurotransmitters in the brain, and sometimes what they say is that the brain is lacking some neurotransmitters, and I'm sure that you know this. You've been taught about this. So those things are missing in the brain, and they do cause the chemical imbalance. So some people are also genetically set for depression, because if you come from a family where someone, especially a mother, father, or sister, have suffered from depression, it's very likely that you're also going to be depressed.
So it's treated with medicine in some cases,
yes.
or therapy in some cases, or both?
The recommendation is that we use both, that we use medication, and there are many different types of medication, and also that we use therapy. And the research shows that a combination of both is what works best.
Okay, and what about the Latinos who turn to a spiritualist for therapy?
Okay. Why do Latinos turn to a spiritualist? And I've had to speak on this a lot.
Please tell us about it.
Okay, first of all, why we go to spiritualists? We go to a spiritualist because, number one, we cannot afford a therapist, which is anywhere from $115 to $150 per hour. Mm-hmm. Number two, a spiritualist don't ask you for an insurance card. You don't have to have insurance when I walk in the door. Okay? Three, it's right in the community. I don't have to get on a bus and go 3 or 4 zones to find the therapist. 4, the therapist speaks my language. Hablo y habla español. No tengo problemas con el idioma. The other thing is...
But does it work? Is it effective?
Well, I can tell you that people feel better when they leave there. I'm saying because
why? Because it's a state of mind?
It's a state of mind. However, with these very severe types of depression, you may feel fine temporarily. You're not going to feel fine for long periods of time. Mm-hmm. That is the difference between going, let's say, to a medical doctor and getting medication and going to a therapist where they do long-term. Espiritista may see you on a weekly basis, but you're not going to feel fine for long periods of time.
Did you ever consider going to one, or did you ever try?
Espiritista? No way.
You never tried that? You went to...
No, I will not go. No, thank you.
Okay. Because why? Why didn't you? Because you knew that...
Because I believe in professionalism. I see a professional doctor and a professional psychologist, and what helps you is that you're speaking to someone that you do not know and listens to you objectively.
And also there are countless stories out there about how they take advantage of people.
Well, they're not taking advantage of me. You know, they're helping me. I'm not saying that has not happened.
I'm talking about the spiritualists.
The spiritualists.
Yeah, there's countless stories about how...
Of course. I mean, as far as the spiritualists are concerned, to me, that's like calling the 900 numbers and asking for your, you know...
For your horoscope.
Yeah, or you know what's going to happen tomorrow. I believe in the power of prayer. That I do within myself. I don't have to go to a spiritualist.
The only thing about that is that spiritualists also include prayer. They include saints, and a lot of them work with what they call the good. They don't necessarily... We have this image that they work with evil spirits, and they work with prayer. They believe in God, and they tell you that we are working with what's good. We also believe in prayer, and a lot of times they'll give you little prayers to take home and say 3 times a week with a candle, and light a candle and do that. So I think that we have to respect it in some ways, because believe it or not, a lot of our people cannot afford therapy and don't have access to mental health centers. Mm-hmm. There are not too many Spanish-speaking therapists in our communities.
Mm-hmm. But in the long run, you say that they are not going to be very helpful.
Well, I think that they should, if they are clinically depressed, or let's say have a bipolar or dysthymic type of depression, they really have to seek professional help. Mm-hmm. I mean, sometimes you can do both.
What do you say to someone who thinks they're experiencing depression for the first time? They're beginning to notice the symptoms that you first noticed. What advice do you give them?
I tell them, look, I tell them exactly what I go through every day. I cannot function without my medication. Mm-hmm. It's very hard for me, but it's something that I have to accept. And I tell them there is help out there. maybe not the first doctor you go to. It might take a while before you find, I mean, you can go to a person and not feel comfortable speaking with them. Because that has happened with me. I've had several doctors. And I say there's a lot of help out there, especially for women. And I do truly believe that there is a lot of depression in the Latin community. There really is. But I think it's because, I don't know, our society just does not educate people enough on things that are actually happening, cosas comunes, things that are happening right now. And someone can actually live their whole life not actually knowing they have the illness.
Is that common?
Well,
People...
I think the work of the therapist, the Latino therapist like myself, is to promote information, knowledge, and education on topics like depression, sexual abuse, these, you know, a lot of the mental illnesses or mental health issues that exist in our community, but also a lot of times they're taboo. You're not supposed to talk a lot about them. We keep them, you know, hidden, and we don't want to talk about them because usually people feel responsible. If I am married to her, as her husband, I may feel some guilt about her depression. I start thinking that maybe I did something wrong. And so a lot of times we have a hard time dealing with that. You're smiling.
Yeah, I referred to that earlier. You know, sometimes you feel like, you know, something is not funny, or what did I do wrong? And it's not you, it's the other person.
Right.
But so it's important to disseminate this information. It's important to talk about it.
Yes,
is that what you're saying?
Yes.
Don't bottle it up.
Yeah.
Don't bottle it up.
And
because that's the one moment you will think of suicide.
Right. That's another important thing, that we have to remember that depression leads in a lot of cases to suicidal attempts. There's a very close correlation between depression and people who want to commit suicide. Because remember that depression is, you feel signs of hopelessness. You don't want to live anymore. There is no reason to live. So the next thing is, what do? You want to do away with your life. You want to commit suicide. So that's why it's very, very dangerous that if we don't take care of it.
And just like friends and relatives sometimes don't understand, probably even less do employers understand.
Oh, of course not.
How do you deal with employers to educate them when you're beginning to suffer from depression? When one of your clients is suffering from depression and is already having a problem with her or his employer, what advice do you give them on how to deal with the employer?
A lot, hopefully, in a lot of corporations and institutions now, they provide an additional service, mental health service, which is really fairly new. It's only been within the last 10 or 15 years. You can go and get a number of what they call counseling sessions, and you don't have to pay for them, and they promise you that they're strictly confidential. So a lot of the companies are beginning to look at this and provide these services for their workers.
Do you talk to your friends about it? When you see somebody who you think might be depressed, do you say, hey, look, you know, you might be going through this?
Yes.
And what is their response? Do they deny it sometimes?
They always deny it. Oh, come on, me depressed? No, I'm just having a bad day. I says, well, your bad day's been lasting for over a month. I says, I know the signs. Why don't you just go at least get a physical? You know, I'll start off that way. Because I know how detrimental it could actually be to an individual. Because it's, like I said, it's within you. It's a constant battle. It controls you. Your brain controls your whole body.
I understand that more women are affected by depression than men. Why is that?
That's what the research... Statistically, it shows that more women are diagnosed with depression, but in bipolar depression, it's equal number of males and females. And I sense, and this is just a thought that I've had about a lot of the different types of illnesses, that some of them are so taboo. It's very hard for males to admit, especially Latino males, to admit that they are depressed. It's so much easier for females to say that, you know, I'm depressed, I need help, I need medical help, I need to see a psychologist. It's very hard in our community for someone with anything that relates to seeing a psychologist or psychiatrist to say that I need that kind of help, because we say, está loco, you see? And so that's very dangerous.
Well, I think you've made a tremendous contribution to disseminating this information, and I thank you very much for being on the program. Time flies here, but it's over now. We have to say goodbye. And I think you've made a tremendous contribution, and I'm very thankful to you, Elena, because in spite of your depression, here you are on a TV program helping other people, and I think that should make you feel good.
It makes me feel wonderful.
Thank you for being here. Let me take a moment to remind our viewers that on June 6, 1998, Imagenes will celebrate its 25th anniversary with a dinner dance at Newark's Robert Treat Hotel. This event will feature many of the celebrities who have been on our guests for many, many years. And you know the list is endless. But let me just drop a few names. Marco Rizzo, Miriam Colón, Polito Vega, Frankie Negrón, Yomo Toro, Johnny Pacheco, Reinaldo Jorge, and a super all-star jam featuring Peter El Conde Rodriguez, Rey Sepúlveda, José Alberto El Canario, Johnny Rivera, and many more Latin legends. We hope you will be able to join us for a memorable occasion. Tickets are limited, so make your reservations today. And for more information, you can call Imagenes at 973-648-7085 or the Center for Latino Arts and Culture at 732-932-1263 or the Center for Hispanic Policy, Research and Development at area code 609-984-3223. We really hope you will be there with us, and in the meantime, we'll see you next week on another edition of Images Imágenes. Hasta pronto.